Eye gel is supplied in a sterile pouch enclosed in either a protective cradle or a cage pack. This innovative packaging is color-coded for size and designed to ensure the device is maintained in the correct flexion prior to use. It also acts as a base for lubrication. Select the appropriate size eye gel according to patient weight. When selecting size, it should be remembered that the eye gel cuff does look smaller than the corresponding size of many traditional supraglottic airways with an inflatable cuff. Ensuring that you conform to local policy for hygiene, open the eye gel package and take out the protective cradle or cage pack containing the device. In the final minute of pre-oxygenation, remove the eye gel and place a small bolus of a water-based lubricant, such as KY jelly, onto the middle of the smooth surface of the cradle or cage pack in preparation for lubrication. Do not use silicone-based lubricants. Grasp the eye gel with the opposite free hand along the integral bite block and lubricate the back, sides and front of the cuff with a thin layer of lubricant. This process may be repeated if lubrication is not adequate. After lubrication has been completed, check that no bolus of lubricant remains in the bowl of the cuff or elsewhere on the device. Avoid touching the cuff of the device with your hands. Place the eye gel back into the protective cradle or cage pack in preparation for insertion. Do not place the device onto the pillow or chest of the patient. Always use the protective cradle or cage pack. Do not use unsterile gauze to help in lubricating the device. Do not apply lubricant too long before insertion. And always ensure dentures or plates are removed from the mouth before attempting insertion. The eye gel must always be separated from the protective cradle or cage pack prior to use. These are not introducers and must never be inserted into the patient's mouth. Insertion technique. A proficient user can achieve insertion in less than 5 seconds. Remove the eye gel from the protective cradle or cage pack. Grasp the lubricated eye gel firmly along the integral bite block. Position the device so that the eye gel cuff outlet is facing towards the chin of the patient. The patient should be in the sniffing the morning air position, with head extended and neck flexed. The chin should be gently pressed down before proceeding to insert. Introduce the leading soft tip into the mouth of the patient in a direction towards the hard palate. Glide the device downwards and backwards along the hard palate, with a continuous but gentle push until a definitive resistance is felt. Do not apply excessive force on the device during insertion. It is not necessary to insert fingers or thumbs into the patient's mouth during the process of insertion. If there is early resistance during insertion, a jaw thrust or insertion with deep rotation is recommended. When inserted to a definitive resistance, the tip of the eye gel should be located into the upper esophageal opening, and the cuff should be located against the laryngeal framework. The incisors should be resting on the integral bite block. The eye gel has a horizontal line on the integral bite block to indicate the optimal position of the teeth. But the teeth may rest safely anywhere on the integral bite block. The eye gel should then be taped down, maxilla to maxilla. When inserting the eye gel, it should be remembered that partial resistance and then a feeling of give way may sometimes be felt before the endpoint resistance is met. This is due to the passage of the bowl of the eye gel through the facial pillars. This is quite normal and consistent with correct insertion, but in such cases, insertion needs to continue until definitive resistance is felt. How to use the gastric channel. If required, a nasogastric tube can be inserted down the gastric channel of the eye gel. For a quick and efficient insertion, it is important that the nasogastric tube and the gastric channel of the eye gel have been adequately lubricated before insertion is attempted. The ideal way to achieve this is to place a small bolus of lubricant over the proximal end of the gastric channel. The nasogastric tube should then be inserted a short way down the channel and moved in and out to prime it before completing insertion.